hapa 1 minute. Tungokondia tona vari kujoina wacho. Right, how many people have returned? Anyone? No, 3. Mm. 2. 1. Okay. Okay, I hope we'll get one more, Grace, because so far it's you and me. You see the disadvantage of having long sessions. It needs people who are academically resilient, because it's at universities it's not unusual to have a 2-hour lecture from 8 to 10. It's not unusual.
Yeah, that's the normal.
So I can see many people have opted to go for a long break now. So let's hope someone else will join in, but we'll record it as well, so it will be on YouTube. Okay, finally we have someone. It's you. Oh, it's my niece here, or my nephew. It's Jerry. Let's see. Let's hope we'll have an independent someone. But let's proceed. It has been a long afternoon. So Grace, obviously, you want to check. Okay.
Sorry, Doc.
Jerry's just fixing something. I was saying let's proceed and finish. It's now
okay.
you and me left. So I prepared this slide to show the nurses that you need to put water. The bigger syringe obviously is for water, ordinary water. But you can use distilled water or even normal saline, that's fine. The smaller syringe, obviously, it's your irrigant. I often use sodium hypochlorite, jig, household jig, but not any household jig. It has to be at least 5%, I think. 5% when you buy, 5%, then you dilute, you can dilute it. But now we also have commercial preparations of sodium hypochlorite. It's already diluted. All you need is to aspirate it. And your paper points. So paper points are also color coded. That's 45, 50 yellow, white 45, red 55. Also comes in size 25. It's also red. That's your blue, size 60, but also size 30, and so on and so on. So irrigation is very important during root canal treatment, the earlier stages. Copious amounts of water and also the irrigant, because this is the one that's going to dissolve the organic material. Do you have someone else other than Grace? No. Okay. So EDTA is another irrigant that is often used. It's very good, this one, for dissolving clogged root canals. If the irritation in the pulp is chronic, the tooth might attempt to deposit calcium deposits. So EDTA is very good for dissolving that away. Also hydrogen peroxide can be used, and also chlorhexidine. But I don't want to say many, but I prefer sodium hypochlorite. It's very good. It's very good. Right. There are dentists who now use rotary systems for filing. They don't do it manual anymore. So that's your endodontic mortar and your special slow end piece there. And they don't use many files. Often they just use three or four. And this is an example of a system that they call a pro taper system. Again, you have to know the sequence that the dentist will be using, so that you provide them as and when needed in the right sequence. So this system is fast, it's efficient, but we always reserve the manual system on the side, because sometimes the root system is so crooked that you can't use this all the time. That's your pro taper versus your manual files. You see, they are much thicker, but you might be shocked that thick as they might appear, they are quite flexible. They can actually follow the anatomy of the root system very well, and they don't break that easily. I don't want to say they don't break at all. They don't break that easily. So they look fat, but they're quite flexible. And this is a comparison with your K files, the manual system where you use your hand to clean the root system. Okay, I actually took this one from my laptop. You will need a lot of x-rays when you're doing root canal. This is root length, root canal working length determination. So obviously this x-ray was taken initially, then you push your file more, then you take another x-ray. We can agree this one is overshot. The file is overshot a little bit, maybe by a millimeter. So then the nurse has to record the working length. You have an endo ruler by the side, and once you determine the working length, it must be recorded by the dental nurse, obviously, or by another dentist assisting the primary dentist. So that when the patient comes next time for further filing or even for obturation, you keep to length. You keep to the length. This overshooting means your file obviously going beyond the root. This is not good. It can cause post-operative failure. Okay, so the role of the nurse here is to make sure the endo ruler is there and the working length is nicely recorded in a way that makes it easier to make reference on subsequent visits. That's an example of an endo ruler. It's a short ruler, metal ruler. It can also be a type that can be hooked to your finger here, so the dentist can do it much easier. Okay, so in between visits, the root canal system is dressed with medicaments, antiseptic medicaments, sedatives. This is an example of a medicament that can be used to dress the root canal system. This is your letter mix. If it's very painful, the nerve is very fresh, you just make sure your paper point is dipped in letter mix, and then it's put into the canal. and you close with your temporal filling. That's an example of a ready-made. Grace, are you there? Example of a ready-made temporal filling, Toxavit. It's not very, very strong, this one. I don't normally use it for interval dressing because it can fail easily. All right. So this is your cresophane, leather mix. These are materials that can be used to dress the canal while waiting to obturate. This is the temporal filling material that I prefer to use in between appointments. Your Durelon, that's a carboxylate cement, very strong. You can also use a glass ionomer. This is Fuji9. And Grace, we were talking about ready mix temporal filling material. I think I wanted to say coltazol. Coltazol. We need to read and see if it's a zinc oxide based or it's a zinc oxide free ready-made temporal filling material. Again, this is not very strong. You might find the dentist might prefer either of these two rather than the coltazol. But if you're in a hurry, that's just as good as well. Right. You can even use amalgam. You can even use amalgam depending on the circumstance, even composite, because remember what you don't want is recontamination of the root canal system. So now we come to sealing the root canal. It needs to be filled. So the assistant has to make sure before the patient arrives, they have the right materials on hand, not to be running around like a headless chicken between surgeries looking for materials. Your gutta percha, a root canal sealing material. This is Silapex, for example, and this is Silapex, which is a calcium hydroxide based sealing material. You can also have zinc oxide indigenous based type of root canal sealer. This is Endomet. It's called Endomet, and there are many. It's just an example of the common ones. And the two-paste system, obviously, it's much easier to mix. This one, like zinc oxide indigenous, it's also a bit harder to mix. All right. That's another type of root canal sealing material, your AH plus AH26, AH26. This is a resin-based type of filling material, much stronger but very expensive, but it has better results than the previous ones. Your gutta percha, different sizes, and also color-coded, like your paper points and the endophiles. The dental surgery assistant has to be familiar with the color codings and the sizes as well. All right, gutta percha comes in different sizes. This has been explained. Your organizer, the nurse has to be careful not to drop this. If you were to drop this, then it's a big mess. But sometimes that's all we have in the surgery. And they're not easy to disinfect or sterilize because it's rubber, remember? So this is something you need to hold with your mind on the job, not with your mind half on the job. So after your obturation, that's your obturation, then you put a filling there. This is before root canal, and this is after root canal treatment. Okay, who is there, Jerry? Okay, welcome back, opportunity. I hope you didn't miss a lot. After root canal treatment, it's often recommended that you put a crown. Opportunity, I'm sure I can follow. Look at that tooth, it is fractured in the middle here because the crown was not put. So sometimes the dentist is in a hurry to go to the next room. You just have to emphasize this. In our surgery, we make the patient sign to show that they've understood, because they can come back, then they blame us for not having told them or given them the option of a crown, because all that work of doing a root canal is gone to waste now. You just have to remove this tooth. So that's an example of a crown. It's a complete crown. When it's like this, it's a complete jacket crown, because you can have a 3/4 crown or a half crown, but this is an example of a complete jacket crown to prevent fracture. So that's the end. Who is there with us? That has been a long session. Oh, grace and opportunity and honor. Honor. Let's have honor introduce himself or herself. Yeah. Is this correct, Jerry? Jerry, I want honor to talk to us. We ask her to unmute. Yeah. Honor, can you introduce?
How are you?
Yes. Where are you based?
Yes, I'm based in Maronda, Dr. Mandish's office.
Okay, we are very happy that you are so resilient. Were you with us when were you with us when we started? You know, we had disruptions this afternoon.
Yes, I was with you when you started. When the sessions before.
All right. So this is the end of our dental materials presentation. We will edit it out and put it on YouTube. So we'll take a long break. I think from now onwards, we'll do longer sessions. Sometime in October, we'll do a long session, maybe 1 or 2 in October, on cross-infection control and microbiology. So let's take a long break. Thank you guys for being with us till this hour. What time is it? I think it's almost 3:30 now. Yeah, 23 to 4. That has been a very long session. Enjoy the rest of the weekend. I hope you have learned something from our presentation. We apologize. We apologize
No,
for
it's quite
disruptions. Go ahead, Grace.
it's quite refreshing, and it reminds me of the times when I was your student. And really, everything is just recap. I'm recapping everything. Thank you so much. My son is benefiting a lot.
Will benefit as well.
He is benefiting a lot. He's also, he has been here.
All right.
The whole time. So thank you so much.
Okay, bye-bye,
please send
everybody.
me the clip. Bye.
Okay, bye, everybody.
Bye. Thank you so much.
Okay, bye. I need to convert it.